Hello, I'm Robert, fact checker and science blogger, and helping people who are scared of many things. So this is about COVID, and I've been following the World Health Organization since the January when people in our group Doomsday Debunk got scared of COVID for the first time. And this is about the very last press briefing which they gave just on Monday this week. So I'm just going to go quickly through. I did a longer video about it. The thing, what hasn't changed, is the new vaccines are far more effective at stopping the symptomatic disease and severe disease, and so this is going to make a big impact on the deaths and on ventilators as we vaccinate more and more of the vulnerable. That's going to happen in the next few months. COVAX is going to be able to vaccinate the entire world together with the richer countries. They've got enough vaccination for 20%, and the rest is likely to be coming as well, because there's a great surplus, especially since it looks like just about all the vaccines are going to succeed in phase 3. There's no sign of the virus becoming any more severe. Vaccines are likely to continue to work, but they're going to gradually, we may need to replace the spike at some point. That's a relatively straightforward process. We have the great success of the multi-drug, multi-country trials, and this helps us. They haven't found any new drugs yet, but the actual concept works very well. And they very quickly found that the first 4 drugs that they don't actually work, and not as effective as they'd hoped to be. But they're on to new drugs, and they're likely to find many new good therapeutics in the future. And when they find them, they will know that they work in many different conditions around the world. The same public health measures work as before: physical distancing, hand hygiene, mask wearing, and 20% of the world is virus-free without using the vaccine at all. None of that has changed, and they'll be able to keep it. They can stay virus-free. The virus hasn't changed. So now what has changed is the virus seems to mutate faster than they expected before. Not nearly as fast as flu, but a little bit faster than, for instance, faster than measles or mumps. And polio, those vaccines, they don't change at all. The vaccine, even for decades ago, then it still works. But it might be that this will gradually evade the vaccine, but over years it's not as fast as flu, so it's not going to evade the vaccine over just a few months, and we're not going to have this thing with lots of varieties of it, and that you can only stop 30% of them like you get with the flu. That's not the problem here. But it's possible over years that we might need a new spike, and then we don't know how long it protects for. Probably at least 6 months, and then beyond that you don't really know, and so you might need a booster shot of exactly the same virus vaccine, or a booster shot of a slightly different one if the spike has to be changed. They don't know that the new virus is getting more transmissible. The UK has very low compliance. There's so many people who are just not doing physical distancing or mask wearing in the United Kingdom, very sadly, and so there's this very high R naught as a result of that. Indeed, the regions with the almost none of the new variant were the 2 highest regions had almost none of the new variant. So that is really why the cases are increasing. It just spin to say it's because of the new variant. It's not. The reason the cases are rapidly increasing in the United Kingdom is because of very low compliance. People just not doing physical distancing and mask wearing, and not testing, not isolating if they're a COVID case. They don't understand that they are putting their own household at risk by their behaviour. So it's very hard to disentangle in a situation like that. Very hard to tell what is due to the new variant and what is due to people just not complying with public health and with other effects like the founder effect, that just so happens that the person with the new variant was the founder for a whole new train of transmission that went on and on and on. So, and then, so another thing that's changing, this is because of the very fast, so what happened is you got many changes quickly, probably in someone who was immunocompromised and then who didn't isolate, because they must have infected someone else. So it's been in their body for months on end, and then at the end they weren't isolating, and then they infected someone else with a new variant that had many changes all at once. And this seems likely to continue, and this will lead to the virus evolving faster, a little bit faster. Now, with that, the end point of the evolution could be a very mild disease like cold. Now, people are mistaken. Some people say all viruses eventually become less severe. That's not true. We have measles, we have polio, we had smallpox, we have diseases that are very severe and that have been with humans for centuries, thousands of years. And so but if you look at it depends on the virus as to whether it's a type of virus that is going to go in that direction. But with flu, it does seem to be, it tends to be less severe. It seems trends towards being less severe. With coronaviruses, then the 4 human coronaviruses are all very mild. And one of them seems to have jumped to humans as recently as the 19th century, and some indirect evidence that suggests it may have caused a severe pandemic in the 19th century. It's not known for sure. It could be H2N2 flu, but the unusual neurological symptoms suggest it could be OC43. If so, then that, looking forward, could be quite promising if COVID does the same trajectory, that that's just in 1 or 2 years it became much less, it turned into a mild disease, because they couldn't have stopped it back then. So presumably it turned into a mild cold over really quite a short time scale. If that's possible, then it becoming an endemic disease is something we could maybe live with. So that's still to be discovered. The preliminary, and that together with the vaccine therapeutics and other measures, and it becoming less severe. So we don't know that. We got this preliminary data from AstraZeneca that was somewhat disappointing, that they found that only 4% of transmission is stopped. Now, that's only about the transmission from other people to the vaccinated people. It's not about the transmission on from the vaccinated people to others. So we don't know. It could be that the vaccine also greatly reduces transmission from other people, from the vaccinated people to others. And in that case, it'd be a much better figure than that 59% suggests, or the 4%. So that with the 4%, that suggests that nearly all the people who would get COVID-19 anyway get it with AstraZeneca, but they get it very mild with a two-dose regime. So mild that they're asymptomatic. And so now if you go and look at that, if you look at the actual history of the natural disease, then with the cluster busting and what New Zealand did and all these other countries, China originally, to stop it with test, trace, isolate, couldn't have been as effective as that if we now know the large number of asymptomatic people, at least as many as there are of the symptomatic people, they can't be spreading it in the same way, because we just wouldn't see it controlled so easily, and we would notice in countries with very good surveillance like Singapore, where everyone with flu like symptoms got tested since the 28th of January for COVID-19. So and then the 59% is very likely not optimal, because we already it went from 70%, I think it was, to 90% at stopping the symptoms with having that half dose first and then the full dose. And so it turns out that there's 2 separate things. There's the delivery vehicle for the thing that creates the spikes in your body, and then there's the thing that creates spikes in your body, a little bit of DNA, turns to RNA, turns into spikes. And the immune system could be that the first standard dose gives your immune system a better key at stopping the adenovirus, that's the delivery system, and that could be why it's less effective having 2 standard doses. Whereas if you got the Pfizer vaccine, then the delivery system is just not being noticed by the immune system, and so it's basically after the delivery system, the Pfizer and Moderna are very similar to AstraZeneca. They just stimulate your body to make lots of spikes. The Pfizer and Moderna use RNA directly, and they insert the RNA directly. The AstraZeneca inserts DNA, which then gets translated into RNA, which then gets translated into spikes. But the immune system stops the adenoviruses, might be stopping the adenovirus with a second second vaccination. So they're trying the idea of using the Sputnik V vaccine, which is based on a different delivery system, using a different adenovirus, which would not be stopped, and so the antibodies to that would not stop the antibodies from the AstraZeneca delivery system. Anyway, that's all a bit complicated, but I don't want to go into too many details in this short talk. But there's certainly a lot of room for improvement. Even with AstraZeneca, it seems very unlikely that 59% is optimal. And then, given that Pfizer and Moderna, then they were better than AstraZeneca with the stopping the symptoms, they may well be better than AstraZeneca at stopping the transmission. And then the AstraZeneca also can probably be improved. It may well be possible to improve it to up to close to the Pfizer and Moderna levels by working on the delivery system, since after that it's very similar to what it presents to the body. So that's the situation with. We may very well have a vaccine that can control it. We just won't know for another 3 months or so, however long it takes for them to evaluate whether they're stopping transmission. Pfizer is going to be doing some results in the first quarter next year. They'll be doing more work with AstraZeneca and so on. So our focus is to vaccinate the vulnerable people first for the next few months, and then after that we will have the data in about whether it stops transmission. We also have much better data about compliance with public health measures. And so I've talked about most of those things already. Right, so I'll just talk about the compliance. So and then we decide whether to go for the moonshot of eradicating the virus. And then that was a very carefully chosen phrase of Mike Ryan, because after all, the moonshot did succeed. And we have the finance and we have the motivation to do this, probably more than we had for the moonshot. So I think it's certainly possible that we do succeed in eradicating it if we go for that moonshot. Now, even if the vaccine doesn't turn out to be right up to there as the 80% or even more effective, we still have, look at California is now at 1.05. This is such a big change from just a week or two ago, when the worst states were 1.3 or something. That is the R naught, but you all probably know what the R naught is by now. So that means another 5% of transmission, and they'll stop the rise in cases per day. Another 5% beyond that, and they'll start decreasing, and then the more you reduce it, the more significant. And this can easily be achieved by more mask wear, more mask compliance, and better physical distancing. If in countries that are not doing that, that could easily tip it over from increasing to decreasing. And then, once it starts decreasing, then it gets easier and easier to control the fewer the cases per day. And so you get this kind of beneficial feedback. And so, if you have a vaccine that is even only 58% effective, then you can vaccinate nearly everyone. And if you do have the cases quite low already, and you are naught is something like 1.05, and you start to relax and it's going up again, bring in the vaccine, and you can turn that to 0.5 or something. And then it will go down very quickly. We saw that with New Zealand. Actually, I think I'll upload this. This is a better version of that other vaccine. I'm playing all the main points. So yes, what was I talking about? New Zealand. There we are. So New Zealand, they got a very fast reduction, more than tenfold reduction in 25 days. And if you did this effectively as New Zealand, and that still works, that method will still work, then if you do the proper physical distancing, it doesn't matter if you've got a little bit more load in their viral load. In fact, that's what is happening in the nasal cavities, because you're not close enough to be infected. You're doing physical distancing, you're mask wearing and everything. It doesn't seem likely to go all the way to being airborne. That's only if it's crowded places with people exercising a lot and poor ventilation, or people shouting or singing and so on. That's where the ventilation matters. You've got to keep a distance outdoors. Many people don't realise that. Keep a distance outdoors, not just indoors. And then we can achieve that. And a tenfold reduction in 25 days. And if you do something like New Zealand, and then you add a vaccine as well, you could do probably that maybe nearly half the time, a couple of weeks. So and then you've got the additional R0 thing, but that isn't going to make a big difference if you do all that properly. So really, the vaccine is going to be adding on top of that for people that aren't doing what New Zealand is doing. But we still have that option. If we turn, I think that Biden, and I said that in previous videos, I'll say it again, that Biden in the United States, he's going to use a similar technique to what Jacinda Ardern did, of talking directly to the people, following the science very carefully, listening to his scientific advisors, doing the tracing. This technique we know works. When you start politicizing it, you don't quite follow the science, you ignore your science advisors, and you don't talk directly to the people, and you don't make things completely clear to them. And I know in the United Kingdom, and most people here don't really understand very well what they're supposed to do, or why they do what they do. It's not being communicated clearly in the way that the people in New Zealand understand very well what they do and why they do it. So all this, I think we're going to see a big change. I think if Biden, the very similar culture to New Zealand, Biden, from best I can judge from what he said and from the character of the chap, I think he's going to be very similar in his style of approach to Jacinda Ardern. And this really works very well. And I think the United States is going to surprise itself. It's got the additional benefit of the vaccine on top of it, as well as doing what New Zealand does. And New Zealand surprised themselves how fast it went down. I think that, so that's why I'm very optimistic for 2021. I think that once we start having a Jacinda Ardern style approach, not of course in the rest of his politics, but in his strategy for COVID-19 in the United States, and I think that we're going to surprise ourselves, and it's going to go down much faster than people expect. And with the mask wearing, people understanding why they're wearing masks and doing the physical distance, and because we are herd animals, I think an awful lot of the reason why we have such low compliance in the United Kingdom is this not at a logical level. It's not happening at a logical level. People are not having it explained to them, so they don't have the logic there to properly understand why they do it. There's a lot of infodemic going around, which is confusing people and leading them to think it's a very mild disease when it is not. There's this thing of the clustering I'll stop quite soon. I'm going to make this 20 minutes. The clustering, that lucky clusters don't make you safe. So so for instance, look at long COVID. There's a 59% chance, for a cluster of 5, that none of your friends have long COVID, even just random, and probably more variation than just randomness. And the same way, if you're 80 plus, then it's 65% of clusters will have no deaths in them, even though you have a 7.2% chance of dying if you're 80 plus. So, but a third of those clusters will have at least one death, and some will have more than one death. And more than a third of the 20-something clusters of 5 will include someone who's been sick for several months with this disease. So we're getting people who are getting confused by lucky clusters. So that's happening as well. And so do watch out for lucky clusters. This should be explained to people, and so they understand this. So I think we have an awful lot of positive possibilities for the future, and that we do have this moonshot and it can come up, it can succeed. So if you look at Mike Ryan's thing, he says, he makes these 2 points. His main, if you look at, actually, I got the quote from it there, transcription there. Okay, I'll stop quite soon, it's 20 minutes. So the moonshot did succeed. We can stop it with the moonshot. We can also make a huge difference to the severity with the vaccine. We are bound to have more therapeutics. The World Health Organization are very optimistic of more therapeutics coming up in the future with more trials. So either way, if it goes endemic, then we end up with something like another cold, an extra cold added. But if we go for the moonshot, we eradicate it next year. And those are the 2 possibilities. And really, it's up to us. It's not up to the virus. Even if we had a 59%, if that 59% of AstraZeneca is as good as it gets, I don't think it can possibly be as good as it gets. We can still stop it, combined with public health, and any country can stop it. And we could end up with a situation where a larger and larger area of the world becomes like New Zealand, where it's completely free of the virus. So New Zealand is going to have its travel corridor with Australia. They could have a travel corridor with China, say, which is a very big economic partner, and go back and forth, and they all be completely virus free. And then there could be other countries. If the United States were to eliminate it, then they would go for elimination. So if you want to go for elimination, that's the last single point now, I'll stop at that. If you want to go for elimination, then you've got to keep on down once you've got even a few cases, like Australia did. Go right in. When you've only got, if you get just even a small outbreak of 29 people, don't be complacent and say, well, we can keep it at a few cases per day. Go in and stop it right away. And just do that over and over again whenever it happens. And that's how you can keep virus free. And that will be the same whether we have a vaccine or not. We can stop it very, very quickly if we do proper public health compliance. And then if you do the public health compliance, you can be the superhero for your community. That was how Maria van Kerkhove put it in one of her talks. So anyway, I hope this gives some of you to be a bit more positive, and this is the background. If you get these rather gloomy journalist reports, how the journalists love gloomy stories, I'd say, but they make things so much more gloomy than they really are. So what I'm saying here, it may seem that I'm sugarcoating. I'm not sugarcoating. This is the true situation. And I just explained things that the journalists are leaving out. I'm giving you the positive. That is the true positive. It's not spin. What I told you just now is the true situation. And we have a very rough time in front of us for another few weeks to months, and we have to just keep with it, with the physical distancing, make it totally automatic. And oh yes, I just mentioned that again. I've mentioned it so many times before, if anyone's following me. But do make it totally automatic. Let's bring it up. Here we are. When you step back, just always step back. Don't have lots and lots of questions in your mind. Make it a habit, like the way when you cross a busy road, you always look both ways. You won't get COVID fatigue if you do it like that. You don't get road crossing fatigue. You don't get people saying, oh, I've crossed this busy street in my city a dozen times a day and I'm so tired of having to look both ways. I'm just going to go across without looking. People don't do that. And so in the same way with COVID-19, then you've had to physical distance 14 times a day. I'm not going to physical distance anymore. If you make it automatic, if you understand the reason for it, if it's totally automatic, you don't have those constant questions. And it's much simpler. It's just like crossing a road. You realise that you need to look both ways. Even if you were to just look at the peripheral vision once or twice, you probably could go across the road and not be killed, or not get an accident. But you are sensible, and you don't think it's worth it for those few cases when there's just a bit of time looking both ways. Same way, it's just not worth it for the slightly extra convenience of being a little bit closer and hearing the other person's voice a little bit louder, and just seeing their face a bit clearer, and then risking COVID when you could just step back 1 meter and see them from a slightly more distance and be safe. It doesn't make sense. as a personal risk assessment. I don't think it does, but you have to make that decision for yourself. Okay, I will upload this now. And but do remember, we've got this moonshot. We still have the moonshot, and the moonshot did succeed. And so I wouldn't be surprised if we do eradicate this. And I think the United States is going to surprise itself with it, my own personal assessment, once they start doing what Jacinda Ardern did.